Auzubillahiminash-shaytanir-rajim. Bismillahir-rahmanir-rahim. I hope you people are doing well, and in this video we will be discussing a relatively uncommon disease, and as previously we discussed anterior uveitis, that is inflammation of the iris and the ciliary body. In this video we will be discussing about posterior uveitis, which involves the choroid, and iris, ciliary body and choroid are the middle layer, which is a vascular one in the eye. In our part of the world, like Pakistan, India, Bangladesh, the most common causes of posterior uveitis are related to some systemic diseases like tuberculosis, sarcoidosis, and rarely toxoplasmosis. And in North America and in some other parts, tuberculosis is rarely seen. Sarcoidosis is seen, and in some areas toxoplasmosis is very common, unlike Pakistan. In this video my aim is on the etiology basically, but before that, the symptoms of posterior uveitis are seeing the floaters, that is black dots in front of the eye, dull pain in the eye, and when you see the fundus you see inflammatory patches or nodules on the choroid. It can be unifocal or multifocal choroiditis, which we also call it in all these diseases which I mentioned. In toxoplasmosis, I want to emphasize here, though it is a very rare disease but must to know disease, there is usually a you can say it is not mostly it is unifocal lesion, and in third world countries we rarely see active toxoplasmosis infection and active uveitis. We usually see people with congenital toxoplasmosis, that is, their mothers might have active toxoplasmosis and transmitted the disease intrauterine, and while examining the fundus, this is an incidental finding that we find a chorioretinal atrophic patch, blackish color, which tells us that this patient has got congenital inactive toxoplasmosis, and we have to do nothing, but gives us the information that his mother might be having an active lesion. Sometimes toxoplasmosis is which we see in Pakistan are in active condition, and that is very difficult to treat. The symptoms are similarly like other posterior uveitis, like floaters, dim light, decrease in the vision, depending on the lesion where it is involved. It can be unifocal, it can be multifocal, and a term is used, head in the fog, that is, as you see the light of the car in the fog, you see the fundus appears like that, the lesion, because it is The vitreous is so hazy. Inflammation in the vitreous is so much so. The vitritis is so high that you are not able to see the fundus clearly. It is very difficult to treat, and there are very limited medicines against this infection, toxoplasmosis, and steroids are have to be avoided most usually, and some antibiotics and other medicines are tried, but the prognosis varies from patient to patient. What I wanted to emphasize in this video that is that toxoplasmosis is one of the rare causes of uveitis, but it is something a must-know thing, because if inactive toxoplasmosis, you inject steroid injection, or even you start being an eye specialist or some other doctor, systemic steroids for some other disease, that may aggravate the disease and it can be very damaging. So this is what I wanted to share with you people, and please write in the comments box what you want to discuss in the coming videos, and we will be discussing the things accordingly. Here I will stop. Thank you very much for watching and listening. Allah Hafiz.